on with Dr. Nelson, who will be talking about the latest devices for aneurysm therapy and what percentage of patients will they have an impact on.
Thank you, and thank you, Alan, for the invitation to be here. Oh, I've only got 2 minutes left on this. All right. Reset? Okay. So just to kind of give you a global start of like what are primarily the concerns that we have here when we're sort of evaluating new technology to treat aneurysms. And I think the thing that makes it kind of important is that aneurysms occur in a relatively young population. If you look at the ISAT data, basically the mean age for enrollment was 52 years old. And I guess from my perspective, that's reasonably young. The concerns for treatment, though, that come out of this relatively young patient with a severe disease is firstly an understanding of the safety of the method, the effectiveness of the treatment, but also the durability, because some of these patients will have to be treated and hopefully one can achieve an anatomically stable and functionally stable result over the duration of their lifetime. So how do we parse out the management of cerebral aneurysms? And I think today basically you can kind of organize it along this list. Firstly, especially since ISUIA data came out, there's an impetus to treat some of these aneurysms conservatively, and I think that's relatively rational depending on their size and the clinical syndrome that they present with. Direct surgical management still has a role, obviously, in the management, but I think more and more the type of aneurysms that are managed surgically become increasingly complex. Recently, an article appeared from a USCSF series looking at the treatment of giant aneurysms, 50% of them now requiring bypass in this cohort. And I think that's kind of interesting because it shows like a new type of skill set that's going to be required of the vascular neurosurgeon going forward. So in the endovascular therapies, basically we can divide these conceptually into deconstructive treatments and also reconstructive therapies. The deconstructive treatments, the parent artery occlusions, are historically of importance and I think still relevant today to manage certain difficult kinds of aneurysms. There is innovation that's occurring in this field, new types of bypass, mostly on the surgical arm of it, and then different devices to use to take down vessels. I do want to point out, though, that if you look at these kinds of aneurysms, it's not always, when we look at the type of procedure, we're really thinking about morbidity related to not only the balloon test occlusion and the workup of the patient, but also what has to be assessed is the ultimate outcome and severity of the disease and the risk of the treatments.